Ms. Rina. Good afternoon, everyone. Dr. Evanuelle Mendoza. Before I start on debunking the myths, we will first delve into what is the truth. Okay, so the truth of COVID-19. So let's start off with how COVID-19 is contracted. Number one, okay, there's actually two ways to contract yourself with the virus. There's the direct method and indirect. Firstly, the direct method is actually a method of wherein an infected individual, for example, would cough and sneeze. Okay, the virus from the infected individual is spread out through droplet spray towards an individual who is nearby. Okay, that is the reason why we have to social distance ourselves, because nobody in this world is fast enough to dodge a cough or a sneeze. So a cough or sneeze from the droplet spray would spread or oftentimes be blown in an enclosed space and might infect other individuals. That is the direct method. The indirect method is when if that infected individual would cough or sneeze to inanimate objects. Okay, when I say inanimate objects, it could be a hand railing, it can be the handlebars or the steering wheel of the car, or it could be a desktop, okay? Or if it were in a practical setting, in a grocery, we'll never know. So if an infected individual starts to cough that up or coughs on his hand and starts touching other things, the virus might be there. So indirectly, when you touch that contaminated object, such as the desktop or our hand railing, you might have it in your hand. And unconsciously, subconsciously, you might want to scratch your nose or rub your eye. That way, you could be infected yourself. So once the virus is inside your body, it takes about a few days, about 5 to 7 days before you could develop symptoms. I said you could because there's a number of people out there who who may present with no symptoms at all. These are what we call asymptomatic carriers. Even if they don't have cough, they might be elicited to have a cough if they pass by a somewhat we say a dusty road or a polluted sector or section or a garbage truck where he might sneeze or cough involuntarily. Okay, this can also still contract the virus. So going back to the symptomatic carriers and those who are with symptoms, that's about 5 to 7 days before you can get the symptoms. And then within that period, that is the reason why people would want to self-quarantine themselves if they have had exposure to the virus, a total of about 14 days. Safe to speak, 14 days is enough time for you, if you had the virus, to see recovery if you had the mild illness. But if you did not have the virus, or if you feel that you're an asymptomatic carrier, it would be enough time for you to build up your own immunity. Okay, so that's basically how you contract the virus. Now, here is the most common misconceptions about protecting yourself. Actually, worldwide, there's only been 3 measures that have been successfully proven and easy to memorize to prevent yourself from contracting the virus. Okay, uh, both from direct and indirect transmission. Number one, most importantly, is the wearing of face masks. So the face masks, before I demonstrate to you how to wear a uh, face mask works in a two-way thing. It's not just about me not contracting the virus. I'm wearing a face mask because I don't want, in case that I might have the virus, I don't want people uh, to get the virus themselves. Okay, you don't know if you might have it or not. So uh, everybody should be wearing a face mask, whether you have the virus or not. Okay. The percentage of which, so I'm gonna use different items. Okay, so for this cell phone, say this is the infected individual, and this remote, sorry I don't have slides prepared, is the non-infected individual. Example, if the infected individual is not wearing a mask and this individual is not wearing a mask, there's 100% chance that the non-infected individual will be infected if the infected individual will cough. If the infected individual wears a mask and the non-infected individual does not wear a mask, there's a a smaller percentage. It varies among statistics. Some say it's 70%, some say it's 80%, but there's still a big chance that you might get infected. If the infected individual does not wear a mask and the non-infected individual wears a mask, there's still a chance for you to get contracted, about 60 to 70%. But if both individuals wear a mask, then there's about, I'm not saying there's a full protection towards it, but there's still only a 10% chance of getting infected directly. Okay, that's a small percentage, 10%. So that is the first thing. Before I go on further regarding that, I want people to have the mentality when it comes to treating this pandemic. Okay, to wear a mask not because you don't want to get infected. You should have the mentality of caring for others. You wear a mask because you don't want others to get infected. You always have to assume. So every move that you have to do, like when you have to cough, you cough on your elbow, okay, not on your hand, because if you cough on your hand, you might have this contaminated. And this is the main tool that we use to reach out and grab things. Okay, at least in the elbow, it's within yourself. Okay, that mentality alone can save everyone. So going back to wearing masks. So here is an example of a mask. This is a surgical mask. Okay. A lot of infographics have been circulating around. The surgical mask gives about 95 to 100% protection when it comes to viruses for lay people. In a hospital setting, N95 is usually the ideal mask to be worn. But this one is ideal. Frankly speaking, supply has been very low for these surgical masks, or if it's not a supply problem, it's usually the problem of the price. It's a lot more pricey. Okay, but this is actually the best. If you don't have a surgical mask, a cloth mask with a 3-ply filter with tissue is more than adequate enough. Okay, but it doesn't give the same protection as a surgical mask. And having to wear a mask does not always mean that you are safe. Okay, like I said, even if everybody wears a mask, there's still a 10% chance for you to contract it. So going back on how to wear a mask. When you hold a mask, it's still clean. Okay, you put your 2 fingers by the ear loops, put it in your face, loop it over your ears. You adjust the corners down your chin. Make sure your chin is well secure. Other 4 corners, loop it over your nose. If you look at it closely, it's looped over your nose. Then you adjust the metal strip to fully clasp the nose. Make sure that everything is sealed, including the sides. No room for entry at all. Okay? So when you're out in public, when you're wearing the mask, do not touch the mask. Okay? This is a cloth. It is absorbent, and for any droplet spray, it might have been contacted there. Okay? Do not touch it at all. Adjustments should be done on the corner or by the ear loop. The whole time when you're out in public, do not try to take it off. I have seen a lot of people when I go out in public that they wear a mask for the sake of not getting caught from mandatory laws that have been placed out. on wearing a mask. Some of them would wear a mask like this. They would try to give excuses such as I can't breathe. Okay, that is not safe. Some of them would have it like this. Okay, this is very unsanitary considering that you will have to pull it back up like that. You will have to keep on touching your mask. That is very unsanitary. Okay, keep it always clasped and touch only the corners. Never touch this area. So when you arrive home, okay, when you arrive home, once you're in your safe zone of your house, still do not touch the mask. Okay, what you do to take it off? Okay, same. Go for the corners. Put the finger around the loop. Do it like that, and take it off. It's as easy as that. If you do not have enough masks or supply, ideally, one time use lang to. Okay, once it's done, dispose of it right away. But if you do not have the privilege or the financial capability to keep on buying very expensive masks, you can sterilize it. The only way to sterilize it is actually through a UV oven or through sunlight. Okay, but that is only as a last resort if you don't have enough supply. Okay, never use alcohol to sterilize your masks. Why? Because the polypropylene filter, which is found in the front area, it will actually dissolve once a corrosive substance such as alcohol or bleach is in contact with the polypropylene filter. With that being in place, air can actually pass through more. How much more the droplet spray? Okay, that is for the masks demo. That is, like I said, there are three ways. Going back, there are three ways to have preventive measures with our fight against COVID. We've tackled one, which is the masks. Number two, this is the hand washing or the proper hygiene. Like I said, going back home, you must make sure that you have been properly sterilized. That before touching the doorknobs, sterilize your hands with pockets alcohol sprays or alcohol gels. Okay, or what most people are doing in checkpoints is having foot baths because you never know that kasi mahilig naman tayo ng mga Pinoy, they just spit anywhere. You'll never know that you stepped on those spit and you're carrying it on the soles of your shoes. That is why disinfecting with chlorine foot baths within our homes is also helpful. Another one is proper hand washing. Once we're at home, please do not rely on alcohol because we know that alcohol is a supply that we're frankly starting to already build up again. But then a lot of people are hoarding this commodity. So try to stick to what is most basic, which is the hand washing. Okay, arriving from home, take a bath as soon as you can. Your outside clothes should not be worn inside the house. Put them in the laundry right away. Okay, but most importantly is still the hand hygiene, because this is what carries the virus the most. Whatever you touch at home, before you do, make sure that your hands are clean. Okay, that's the second way to prevent the virus. That is that hand hygiene and basically self-hygiene prevents indirect transmission of the virus. Lastly, the social distancing measures. Okay, since we cannot dodge a cough or a sneeze, nobody can, and that split of a second, nobody can. So scientists have been measuring it up. A lot of people on YouTube have been trying to measure the distance of a droplet spray more or less, unless you are a trumpet blower, it takes about 1 meter for the droplet spray to actually come in contact to you. Okay, so a lot of people have this common misconception that if they stretch out their hand, that is the proper social distancing. They don't keep it in mind that wherever you go, whatever that you do, social distancing should be the key. Okay, whether you're in line for the groceries, you don't need the marks on the floor. You should always have it in your head and discipline yourself or adjust to people who are not following the social distancing technique. The best way is to spread your arms outright, then give it a twirl around. If you don't hit on anybody or any surface, that is a good distance enough for you. Okay. Social distancing actually protects you from indirect and direct transmission. So those three methods I will recap: proper self-hygiene, wearing of a mask at all times, and lastly, the social distancing or the staying at home. Staying at home is actually a form of social distancing with a shield called your house. So if as much as possible, if you can stay at home and go out only for essential trips. Okay. So before I move on to the next topic of the current status and statistics of our local setting, is there any questions regarding the truth on how COVID-19 is contracted?
Doc, we have one question here before we move on. We have one question from James Biron. If I buy items online, is it possible that I will get infected by these packages from abroad?
That's actually a very good question. So far, that's the reason why a lot of our shipments have been delayed because one, it's a skeletal crew in our customs, and two, uh, the essential items are the ones who are being given priority. And lastly, also, I'm sorry, number three is that they are disinfecting these items before it is being brought to your doorstep. So, uh, and as an extra measure, once you receive the item, it doesn't hurt anybody if you take precautionary measure and try to disinfect it yourself before trying to use the item. Okay, it doesn't hurt anybody naman. Are there any other questions?
Doc, probably we can save all the questions after your
Ah,
presentation para, yeah, dire-diretso tayo. Thanks, Doc.
okay, sige. So moving on, the current status or statistics in our local setting. So for the hospital setting, let's start off with that because that's the reason. That's the reason why we're doing these preventive measures. Because I'm pretty sure you guys heard of the hashtag flattening the curve. Okay, when you say flattening the curve, it means that the number of cases that are going up, knowing that our Philippine setting, we're limited to about 11,000, correct me if I'm wrong, 11,000 hospital beds. And that 11,000 hospital beds, with our population of 109 million in the Philippines, I don't think we can cater to everyone. Okay. In Manila, there are some hospitals who are already working at capacity. Okay. Over 1,500 healthcare workers in the whole Philippines have already been infected with the coronavirus. That's in the Manila setting. Uh, for the Cebu setting, though, I'm happy to say our hospitals are not overclocked, overworked. They are not yet at full capacity. A lot of them have been following the proper protocols. A lot of them have, a lot of the patients, a lot of the people have been avoiding hospitals as much as possible, which is actually good. And there are different measures doctors have been doing to lighten the load of the hospital, such as giving free consultations online. Uh, I do the I do those free consultations myself as long as it's COVID related. Okay. Other than that, so far the Cebu setting has been coping up well in terms of the hospital setting. But when we come to the marginal setting, it's been a little bit more difficult than it should be. Just because a lot of these individuals in Cebu, or I'm not just saying Cebu, the Philippines per se, that are undisciplined and still cannot uh, grasp the gravity of the situation. That is where fake news and the myths about COVID-19 will come into play, which I will explain later. Okay. For the industrial setting, I'm pretty sure the economy has been hurt a lot, mostly from the tourism, exports, and the leisure companies such as hotels, uh, uh, malls, and spas and beauty salons. They have been hurt a lot, but then money can always be obtained. Life cannot. Once a life is lost, you can never get it back. That's why we must work together towards that. Okay. Right now, the total number still has been increasing at the rate of about 100 to 200 cases a day. With the testing that we've been doing so far, uh, previously the testings have been at the rate of 2,000 per day, but now it has increased to about 10 to 15,000 a day, considering that there are more level 3 or level 4 facilities who have been running the tests in the Philippines. If I remember correctly, there are over um, 54 facilities nationwide. Okay, in Cebu alone, there are about 4 facilities doing the testing. So, and more good news in that matter. Uh, the testing previously, when this pandemic started, we had only about 80,000 test kits. But now we had donations from different private organizations, different countries. We have about 1.8 million test kits. Okay. There was one concern regarding testing, though, about mass testing. So here's one of the myths that people would want to hear about. When we're talking about mass testing, we don't mean testing everybody. For one, if I am not a PUI or I am not the PUM, I would not want to be tested because it is very uncomfortable. Imagine the size of a regular office pen. Now increase it about an inch longer. That is about the length of the throat swab that they're going to insert through your nose to the back of your throat. And they're going to do it 3 times. That's how they would get the result. That's very uncomfortable. Now, why does it need to be 3 specimens? Okay, despite the fact that these specimens need to be collected because the accuracy of one specimen, okay, the accuracy of one specimen is only about 67%. That's about 2/3 of a chance lotto. That's why we need to collect 3 specimens to make sure that if you have it or not. This is the gold standard of testing for coronavirus. It takes about 24 to 48 hours to get a result for that. Okay, it used to be about 5 to 6 days. Now it's 24 to 48 hours. Now there's been circulating around when it comes to the testing of the rapid kits. Okay, that takes only about 10 to 15 minutes to know if you're positive or not. Little clarification on that. It's not a rapid kit per se to test directly for the virus. It only tests for the antibodies against the virus. So say if you're an individual who was not able to elicit an immune response or has not combated the virus, but the virus is within you, meaning you have not created antibodies, which takes about 3 to 5 days to form. You will not be positive in that kit. So saying if you're an individual who has the virus, who tested negative for that rapid kit, is confident to say, I don't have the virus, and starts walking around, you could be infecting other people. That is why we would test directly for the virus and not the antibodies. So what is the purpose of these kits? The kits can help us identify if we have developed the antibodies towards it and if we are already on the recovery after being infected. Okay, so that is basically the reality of what we have now for our testing kits. To give you an idea of the marginal sector, those people who are on the class C, D, and E, those who cannot afford to stay home, a lot of them have been crying out, bigyan mo kami ng ayuda or the social amelioration program. Okay, the reality is a lot of them are really affected, and I'm happy to say a lot of the private sectors have reached in and helped out in some little way. From the Bayanihan Mission, they have been trying to not just give relief goods, but help educate them, because information is actually the best way to make them understand why they're not being disciplined. Okay, we need to work together. Like I said, we need to work together, not just those people who are more financially placed, but also those people who are economically affected, class C, D, and E. Okay, helping them understand what the situation is like will give them a better understanding as to why they should be more disciplined when it comes to going out in public or wearing a mask. Okay. Now, for the localized outbreaks, I know in Cebu, I'm not very familiar of the outbreaks in Manila, but here in Cebu, having circulated different areas on the outsides, not in the end, on how it is from there, I think it's a very good strategy trying to lock down different barangays, because that way economically we will be able to contain or help those who need it the most. Okay, and at the same time, the localized outbreaks are well contained. Having spoken to the AFP and the DOH who are manned at these stations, treatment has already been given. Treatment for those people who are symptomatic. They are placed in barangay isolation centers. If not barangay isolation centers, there are different facilities within Cebu, such as the one in IEC, the one in North Reclamation Area, and the Old Sacred Heart Campus. These are facilities to hold those positive individuals presenting with symptoms. For some people who refuse to go to these facilities, they are advised to do self-home quarantine. Okay. Frankly, as long as you have the social responsibility and you're aware, please, please, please stay home if you're one of those individuals. Okay, because right now, I think I saw one of the a chat window that popped up regarding the vaccine. Okay, when it comes to the medications and the vaccines, so far there has not been any medication that has been fully approved worldwide on the treatment of COVID-19. There have been medications undergoing study regarding the medications such as the hydroxychloroquine, the very known anti-malaria drug or chloroquine, and Avigan or your remdesivir. Okay, they have been shown to have promising studies. Okay, but it should be taken into full consideration that for example, the hydroxychloroquine and the chloroquine, an ECG should be given or should be tested prior to starting the medication, because hydroxychloroquine is known to cause arrhythmias. Okay, it is known to cause palpitations or sometimes even death. Okay, that is why it should be taken into consideration the heart condition of a patient. You should weigh the risks before the benefits. That is why it's still undergoing proper testing. Okay, for the vaccine though, the vaccine is currently under phase 3. For those people who are unaware, phase 3 is actually still testing, human testing, before they reach into phase 4, which is a controlled population. So the earliest date for a vaccine, is actually April 2021. That's still next year, because they need to have a period of time to see if the vaccine has no side effects for a different type of population. Will it show any uh, um, signs of flu-like symptoms, or will the virus mutate, or so on and so forth? There are a lot of reasons as to why, or a lot of variables that the research team has to tackle before having to market this vaccine out into the public. Okay, um, but until then, until we have medications for it, until we have a vaccine for it, the new normal, which is our uh, quarantine, which is our social distancing, is going to be like that for quite some time. Okay, so we will have to adjust to this new normal, and we need to work hand in hand to implement this, so as we won't be congesting the hospital. Okay, so that is basically the current status, or the current picture of how it is here in the Philippines. Now we will move on to the myths and facts of COVID-19. There's a lot of it going around in Facebook. Okay, um, frankly, from my own circle of friends, they've been sharing it to me, but I don't know how it is for those people with non-medical friends. On, but I've seen it in chat groups of my family, knowing that a lot of them are vulnerable or gullible to whatever information they might get to say fight the virus, and some of them would even result to believing in them. So one of those myths is actually the boiling of water, adding salt and ginger, or whatever the mixture, basta yung boiling of water and healing the steam. Okay, that is actually a myth. It does not fight off the virus. What it does, though, is that it helps alleviate symptoms. So if you do have an itchy throat, you have a runny nose, it does help alleviate the symptoms. It does not kill the virus, though. The virus, the only known way in the whole world for now to uh, fight off the virus is actually just to wait it out. You treat the symptoms and you wait it out. Make sure those symptoms does not become deadly or severe until until your body has developed an immunity towards it, and the virus has already been flushed out by your own body. That's the only way. Okay. So another myth is a lot of this in the marginal sector have been uh, expressing this towards us, that this COVID-19 is actually just a sickness for the rich, because we are poor, we're exposed to more viruses, we're more exposed to more bacteria, more sicknesses. We already have developed an immunity towards it. This is not true. Okay, whether you're poor, you're rich, you're the president, you're the pope, you're whoever you are still vulnerable to the virus. Even more so, I think I've seen one question window pop up regarding asthma. you are very vulnerable if you have asthma, because your asthma might trigger at the same time. Okay. Um, Another myth is just because I'm taking vitamins, I will be saved from the COVID-19. Okay. Vitamins, vitamins per se, it only helps with the resistance. Resistance is not a full protection. It just helps you fight it more, but it does not save you from the COVID-19. No, like I said, the only way to fight off this virus is actually just to let it pass away. Let it pass as your body tries to fight it on its own. Okay. So another myth that a lot of people have been saying, especially in America, that no that has led them to um, riots, saying that I've never America has never closed down for a flu or a fever. Why close it down now? So it's not just the flu, okay? It's not just flu-like symptoms. It's not just fever. It's not just an ordinary cough. For you, it might be. For some healthy individuals, young, strong individuals, it might be just like that. But you have to care for those people who cannot fend for themselves. Elderly, those above 60, those with diabetes, those with hypertension, those who are immunocompromised with HIV or cancer. These people are very, very, very vulnerable, and they might have it worse. That is why don't treat it just like the flu, because the flu is very infectious and you might contract it to someone you love who have these comorbidities or health handicaps. Okay. Now, regarding the sunlight, a lot of the marginal sector have been believing in the myth of that the virus will actually die within the sunlight. Okay, this is not completely true. It might die from the sunlight, but it should take time, depending on which surface the virus has landed on, whether it be wood, plastic, or metal. Okay, for sunlight, it takes a lot more time for it to disinfect. Okay, to give you a good idea, whatever surface it may come in contact to, it takes about 2 to 12 hours before the virus actually dies out. Okay, within 2 hours, the virus should the virus does not have to mean that it's killed off by sunlight. Okay, sunlight though is actually very good for you because it helps, especially the sunlight that you get from 10 a.m. and below. That's the only, that's the only reason why sunlight is good for you, because it promotes vitamin D production within our body. Vitamin D, a natural form of vitamin, can help us with fighting off to help us to form a resistance against infections. But again, resistance is not the medication. It's just an aid. Okay? Another myth is yung mga magulang lang yung mahahawa. Not all. Okay? Mostly, sorry, I'm gonna rephrase that. Everybody will get infected, but those who are most affected, huh? Not infected. Those who are more affected are those who are elderly. And I mentioned before the different classes, whether you're young or old, if you have those health handicaps that I mentioned, you are actually at risk. There have been cases of infants who have asthma who have died. There have been cases of, there was one case in Cebu wherein a 27-year-old female, okay, who, although she's perfectly healthy, just because she had a infection of her own, she was battling with a different infection of her own. She also contracted the COVID-19 infection, also had severe symptoms. Okay, there are some elderly who have survived, which is good. Okay, but not all of them are that lucky. Most of them usually end up in very, very poor conditions. And if you look at the statistics being presented, because DOH has been very transparent about it, um, a lot of these deaths, about 80 to 90% of these deaths, would have comorbid conditions. Okay, so please, 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 let's debunk that myth that only the elderly will be infected. Another myth is this is actually funny. This came from one of the marginal sectors. The the medic the only way to fight COVID is to drink ginger tea or pula na itlog. Now, there is no science towards this. This is basically just beliefs of the elderly. Okay, I don't need to explain that as much because there is no science towards it. Another myth is do not approach people who have cough or colds. Okay, that doesn't mean that if you have cough or colds, you have COVID-19. But we always have to have a precautionary measure. That is where social distancing is in place and wearing of the masks. Okay, it is ideal not to approach them. Okay, ideal because we always have to treat everything and everyone as contaminated. Okay, but we should always have the heart to think that they are still human beings. Okay, so if you do notice people, okay, if you do notice people coughing or sneezing, the best way to help out the situation, if he's wearing a mask, tell him to cough in his elbow. It would most likely decrease the droplet spread. Okay, gently tell him you shouldn't be out if you're having symptoms like this. We should work together like that. Parang ano, even if you know that you're ano, coughing or sneezing, and if you're not positive, what kills more right now is actually not the positive, but the panic that he might carry on. Okay, so be gentle, be altruistic, be human in telling them on what to do. Okay, this one, there's another myth. Yung alak daw, makapatay ng coronavirus kasi alcohol yun. This one is actually very funny to begin. One, it's not the same type of alcohol. Okay, the alcohol, isopropyl and isopropyl alcohol is used specifically to kill the virus and at the concentrations of 70%. The alcohol in your drink cannot reach that high, 70%. If you do, you'll be intoxicated. And at the same time, drinking of alcohol lowers your immune system. So as much as possible, avoid vices, smoking, drinking, okay? Not sleeping well enough, not exercising. Those will lower down your immune system, okay? Drinking of alcohol, if done within the confines of your home, is okay, but please do not intoxicate yourself. That will only lower your immune system. It will also dehydrate yourself, making you more prone to infection. We've got last two myths. The second to last is we should be distancing ourselves from people working in the hospital kasi they are the ones who are most likely infected. This is very, very untrue. These people in the hospitals, nurses or doctors or guards, are auxiliary, they are they're more aware of how to disinfect themselves, how to social distance themselves than the regular lay person. Those wearing PPE, they are very careful on taking it off. And if they do feel just a slight contamination in their part, they take up the social responsibility of isolating themselves from the community and their families. A lot of my friends have been doing so themselves. Even if they never presented with symptoms, they self-quarantine themselves. So it's very inhumane to treat them differently, knowing that they're they're the frontliners. They're the ones who are actually battling it. Okay, so please do not treat them indifferently. They know what they're doing, and they most likely know how to disinfect. Need more people like that. Lastly, of the myths that I have listed down is you can actually get COVID-19 from food that are not sorry. You won't be getting COVID-19 from food that is properly cleaned. Okay, like I said before, the safest way to handle your food is actually to clean it yourself. You prepare it yourself. For those people who are um, although I'm not saying that Food Panda or Grab food delivery is not safe. They have taken measures to actually disinfect or make sure that their employees are uh, properly screened. Okay, but it's still the safest way to make the food at home. Home cooked meals are still the best way to make sure that you have clean food and not contaminated food. So for cooking, the heat from cooking kills already the viruses. But for those people na gusto talaga ng raw foods, as long as you know that it's reliable source, it's clean. But so far, I have not heard of cases who have contracted the virus from raw food or ano, look in the nationwide setting or the international setting. So far sa Japan, wala pa namang cases na galing sa sushi. Pero it doesn't hurt to take precaution towards it. Okay, so I think that ends uh, my panel for different myths. So I am now open for any questions.
Yes.